Okay, well, we will go ahead and get started. Again, my name is Erin Einhauser with the Pennsylvania Health Access Network. We're really happy today to be joined by Noni West, who is the coordinator for PROACT's Family Program and Public Policy. PROACT and the Council of Southeastern PA do incredible work with individuals and families in recovery in the southeastern part of the state, and we're working together to better connect the recovery community and folks supporting individuals in recovery with the enrollment community, and that is the purpose of today's webinar, to help enrollment assisters better understand unique challenges and barriers that Pennsylvanians with substance use disorders have faced, what's important for them in terms of benefits and treatment and services, and how to partner locally with organizations to get the word out about the opportunity to enroll, so that we're connecting as many people as we can with coverage and ultimately with treatment so that they can achieve and maintain recovery. So we'll kick things off. We will cover these points today in the session. We want to talk about building a bridge between the recovery support and the enrollment community. We want to cover the challenges that Pennsylvanians with substance use disorders have faced on the road to recovery. We want to focus then on messages and strategies that work to reach and to motivate people to enroll. And then really focus on what organizations are in each county that could be new partners to work with to get the word out about enrollment. I should say, too, that we're recording this session, so it will be available after the fact, so you can share it with any enrollment colleagues or partners. I'll also email out a copy of all the materials and links to the resources that we referenced today. So why focus on this now? Obviously, things are very different now under the Affordable Care Act. Coverage is available to many millions more Americans, and that coverage is comprehensive. It covers the benefits and services that people with substance disorders need. So it's estimated that now that we have the Affordable Care Act, 7 million uninsured Americans with behavioral health needs became eligible for coverage either through the marketplace or Medicaid, and an additional 5 million Americans gained coverage that includes substance use disorders due to new parity protections. Now all health plans have to cover behavioral and mental health and substance use disorder services at parity with physical health. So really important services like residential treatment, inpatient detox, outpatient, and partial hospitalization are now covered, whereas they weren't, or often they were, but very sporadically or with a lot of limitations of the Affordable Care Act. Things are a lot easier now in Pennsylvania with a simplified, streamlined Medicaid expansion. Still, a lot of people don't know that. We had a coverage gap, unfortunately, in 2014, and we know we've all experienced it, that a lot of people were discouraged, upset, really disheartened because they thought that healthcare law was going to help them, and in the first year it didn't. And that was, obviously not the fault of the Affordable Care Act. That was a state decision, but people who got turned away in that first year were understandably discouraged and upset. So it's really important to reach people, not only those folks, but also people who might have had a bad experience or been wrongfully denied just due to the complications and the complexity of health PA, which thankfully now is finished as well. So there have been a lot of improvements to the Medicaid application process. Eligibility is a lot easier now. As we all know, there's no more asset test for the Medicaid expansion group. And thanks to a policy clarification, county assistance offices not only look at your monthly income as an applicant, they can also make an eligibility determination based on your annual income, where people are getting unemployment that's about to run out, in places where people are seasonally employed, or they're self-employed and their income is expected to decrease, even though it might be just a little bit too high to qualify under the monthly limit. Also, the harmful limits that were in place in Medicaid on many mental health and substance use disorder treatment services have been removed, and the 6 prescription drug limit a month is also removed. So Medicaid now covers these benefits without limitation, and you can find this benefits chart at healthvoicespa.com, which is Pennsylvania Department of Human Services website, which is actually really good and updated frequently with both consumer-facing information and also information that's helpful for enrollment assisters and partners. So this is important, very important. This is information from SAMHSA about who has behavioral health conditions among people that are uninsured and eligible for Medicaid. And you can see the statistics here that there's a lot of need for people to get access to substance use disorder services who are uninsured and are now eligible for the Medicaid expansion. And the next slide shows how many folks in the marketplace universe have behavioral health condition and are uninsured. So there's a huge opportunity to reach folks and not only to enroll them, but to get them connected up with treatment, and that's the ultimate goal. So at this point, I want to turn it over to Noni to talk about what is recovery and just give us education about understanding what people with substance use disorders face and how we can help as enrollment assisters. So let me see here. Noni, I think I'm just going to advance the slides for you.
Okay. Hello, everyone. The one thing I do want to, when the exhibits that Erin was just showing you, there are also, when I was doing some studying, Pennsylvania in the lower income populations has a higher incidence of substance use disorders than other states. And actually today in the Inquirer, there is an article entitled Pennsylvania's Young Men's Overdose Deaths Lead the United States. So right now, Pennsylvania and New Jersey, unfortunately, are leading the, Pennsylvania leads the nation, so they're saying, and New Jersey is the fourth. This is just out. I haven't had any time to sort of look at this data. Oh, thank you. And analyze it, but there is, in the article, there's also apparently reports that back this up. And the Hilton organization, I think, is behind a lot of this because they are very concerned about prevention and getting expert covered in insurances, which we can talk about later, which is an early intervention technique for addiction. So what we'll first talk about is what is recovery. And recovery is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. And that is SAMHSA's most current definition of recovery. At one point, it included the aspect of abstinence. But since moderation is also considered a recovery, as long as everybody is taking care of the health domain of their life, their home life, their purpose, and community involvement, people can be in recovery if they use moderately. There are identified 25 million people in recovery in the United States, and 10% of those have actually gone to a treatment facility. So there's 90% of the population who have recovered through other means. What helps people maintain their recovery, and what is important to this audience right now, is access to treatment and recovery support. What I included as the second point is really education for the individuals and for the families themselves, because if they understand the dynamics and what the science behind recovery, it helps everybody, including the individual, to support their recovery. Health and then there are basically domains behind a recovery, which is taking care of health and wellness, education and vocational skills. Many people who are in recovery and in addiction have not really taken care of that part of their life, because addiction starts very early. Steady employment and job readiness, safe and affordable housing, a sense of community and belonging, and safe and sober social networks, and life and recovery skills. So the next slide is what are the barriers and challenges. that make it harder for people to recover from addiction. And what I thought is really most important is the stigma of addiction, because that is prevalent and has been prevalent for people's perception of addiction for a long time. And here I am showing my age, depending upon the audience. In the 1980s, in the Just Say No generation or era, let's put it, the ads ran, this is your brain, this is a normal brain, and this is your brain on drugs. And it was an egg in the sizzling sound of a frying pan. And there have been advances in society, science that have revolutionized our fundamental views of drug abuse and addiction, and that is now the recovery-oriented care understanding of addiction, which is a brain disease. And in that visual, what you see on the top line is a healthy brain. The second line is a brain of someone in addiction, and you can see that the brain functions, the yellow areas are the active areas, and that the brain seizes portions of functionality. And then you see a brain that is in the early stages of recovery, and the functionality of the brain begins to come back. So the challenge is, what happens with the stigma is that individuals fail to seek treatment because they are embarrassed, there's no support for it, their families are in denial and do not help them. I coordinate our family education program, and the statistics show that it takes families about 7 years to actually admit that there is a problem with the family and try to seek help. The medical profession fails to treat addiction properly, and actually, sadly, addiction is not part of the basic education for people who are going into the medical profession. And they don't know what to do. There was I guess there was a study done when doctors realized and asked people if they had problems with addiction, what they didn't know what the next step should be if they asked that question. So for a lot of doctors, that question isn't even asked. And considering the prescription drug epidemic, some doctors don't really care. Also, one of the consequences of addiction is that people go to jail. And I was watching the police commissioner or captain in Gloucester, Connecticut, where they are actually not arresting addicts anymore, but what they are doing, they're giving them the option of going to treatment. And the chief of police was saying that after dealing with addiction for so long, what he realized is that sending people to jail is not the solution, and that's why they have gone the path of creating a community of treatment centers who will cooperate in sending people into recovery in treatment. I think they've sent about 150 people to treatment centers at this point. And people in recovery still face stigma-based roadblocks, especially anybody who has a criminal record. They have difficulty getting jobs. And there are people in recovery who in their work environment will not even address the fact with the people that they work with that they're in recovery. So there is a lot of fighting from stigma. Why is it harder, and what are the barriers and challenges for people with substance use disorder? When I started to write this page, I said, let me count the ways. So these are just some of the main issues. There is a very strong relationship between addiction and mental health. A lot of people with mental health issues use alcohol and drugs to self-medicate. So when people are looking at their addiction, they are not realizing that there are actually several issues that need to be dealt with. And we're finding in the family program, when we take people through the program and and mentioned that the mental health issues and trauma can strongly affect people's addiction propensity. Families start to realize that there may have been incidents like bullying or trauma in early childhood that may have contributed to this, or mild depression, or their children just want to, are shy and want to go out, and socially it gives them confidence. So they start to realize that there's another aspect to addiction. And what addiction does is hijack the brain. It affects the ability to reason. And so when people are in recovery or go into recovery, what they're not aware of is that the recovery is going to take a very long time, because it can take the brain 2-3 years to actually get back to a normal state. So going through treatment, a 30-day treatment, and coming home and expecting everything to be the same again is not really what happens and occurs. So the individual is disappointed, and many times families have much higher expectations of the person who is in recovery than they can actually deliver upon. And so that is going to undermine someone's recovery. Recovery is a lifetime commitment. It's just like handling any other disease. If you have diabetes or high blood pressure, you have to maintain and pay attention to that for the rest of your life. And addiction is very much the same. Many people who are recovering from addiction have started their use of drugs and alcohol early in their life. And what that has done is interfered with their growth and development, both socially and educationally, and can affect job paths. So many of the families who are coming to us right now have known that there's been difficulty with their children, but it isn't until they leave home and either can't cope with going to college and are failing at that, or go out and try to find work and maintain jobs, that they start to fail. And that's when families realize that there is a problem. And it's because they have not experienced the ups and downs, the natural ups and downs of life, and learned from them, but have protected themselves with the altered states of drugs and alcohol. And so that stops their learning and their growth. Then, of course, there is the access to care and insurance coverage. Insurance hasn't covered it. There's the issue of length of stay. Some people go in for 5 days, and then all of a sudden the insurance won't pay for it anymore. And then there's the whole continuum of care that is associated with the lifetime of recovery management that insurance does not cover. Of course, the care reform with PEDI, the Affordable Care Act, and the understanding of the continuum of care is changing things, but it certainly is not changing quickly. So what we have here is the basic continuum of care. And this is the access to the full range of care that can help someone get into a complete and healthy recovery. So that includes your detoxification, physical exams, medical care. It covers counseling under psychiatric, medication management under clinical. Of course, that's going to be your inpatient treatment and your outpatient treatment. And then there's the psychosocial, which is your one's environment. And PROACT is a recovery support organization. And this is where our services come into play, is helping somebody make and continue their recovery through management. And recovery support is one of our core areas of expertise. And then we'll talk about the fact that that is not covered by private health insurance as we continue. So the services that are included in the continuum of care, which is the next slide, is the recovery support services. And those services are really an umbrella over the whole continuum of care. An individual can talk with people, and when I'm talking about recovery support services, we're talking about peers who actually have been through the same experience. So if somebody is questioning whether they need to get into recovery, they can start with a recovery support specialist. They can, if they go into treatment, they can have the support of a recovery support specialist. And then when they get out of treatment and out of recovery housing, they may choose at that time to use the services of a recovery support specialist. There's medically supervised detox and non-medical detox. Some people actually choose to detox at home. That is not recommended. You should at least consult a doctor, but it is totally doable. And there's intensive residential treatment, intensive outpatient treatment, supportive outpatient treatment, which is not as frequent as your intensive outpatient. There is halfway house recovery. A lot of people come out of treatment and they go into a halfway house, which is a more clinical environment than your sober living environment and can be covered by insurance. There's individual counseling and therapy, mutual support groups, which are expanding. The 12-step programs have been very prevalent and helpful since created in the early 30s, but there are many more new forms of mutual support groups that use a more evidence-based approach. And actually, yoga is very instrumental in helping people in their recovery. It has been proven now that it can rewire the brain. And then, of course, there's the ongoing commitment to sustaining your recovery. So reaching people and motivating people with substance use disorders to enroll is, you can create targeted outreach material. But the best way, the reasons for people to want to get into recovery is for themselves and for their families. And many times the message may be that they understand getting into recovery for family more than they understand for themselves. But the best way to reach the recovery community is to meet them where they are. So there are recovery organizations around Pennsylvania, and they are growing. The recovery-oriented system of care and the recovery movement is about 15 years old now. So there are more organizations cropping up. PROACT was one of the first in Pennsylvania, along with the RAISE Project. And PRO-A is actually an umbrella organization over all of Pennsylvania and helping and nurturing recovery organizations along the way. So if you are trying to look for an organization to partnership with Pro-A would be a very good resource. Pro-Act in the Council of Southeast Pennsylvania is in Southeast Pennsylvania. The RAISE project is in Central Pennsylvania, and we have listing here, Faces and Voices of Recovery is a national organization. Young People in Recovery is an organization in all of Pennsylvania, and then of course there's the National Alliance of Mental Illness. There are a lot of recovery events. If in your area there are recovery community centers, they will have trainings in their centers. So it would be wise to ask to do enrollment sessions. That it would be very welcoming. And some of your recovery organizations are may be more advocacy oriented and will definitely help and assist. Recovery housing. A lot of people who are in recovery housing do not have health insurance. And that would be a really good place to do enrollment events. Needle exchange programs. Prevention Point is very cooperative in wanting to host enrollment events. Homeless shelters and treatment centers. A lot of facilities that for mental health where they're housing people will be very open to them. And also the Pennsylvania, each county sort of rules itself. So the SCAs, single county authorities, would be a good place to check in as well because they are open to and getting people enrolled. It will make their life easier. Right now, ProAct and FAN, we've been working together for a year, and we are looking at doing on-site enrollments at recovery houses, and we actually want to do enrollment in Kensington. I don't know if anybody is on the line from Philadelphia, but Kensington is a very it's not a good area of Philadelphia, and there are a lot of drug overdoses in that area and people in the street who need help. And there are a lot of groups who actually go in and work with people and bring them blankets and food and wake people up to make sure that they are not overdosing. And areas like that would be a good place to do enrollment if you can partner with the people in the community who are helping. So, I mean, we sort of went through this. What are the organizations who are dealing with addiction and recovery doing in your community? Well, yes, there are holidays and New Year's events coming up. There'd be a lot of activities at this time for to reach the recovery community. So we've listed some organizations here, the Pennsylvania Department of Drug and Alcohol Programs, and I mean, they are definitely on high alert. Gary Tennis is very involved in the community. He's our director, and so they should be very helpful. As mentioned, your single county authorities. There is the Pennsylvania Network of Care is a great website, and it goes county by county, and it will give you your treatment centers, your recovery centers, homeless centers, mental health resources. It really is a wealth of information there, and it can give you geographic information. The Department of Human Services, the Office of Mental Health and Substance Abuse. In Southeast Pennsylvania, the Southeast Mental Health Association is very active and does great advocacy, as does the umbrella organization that's in Harrisburg. The Pennsylvania Recovery Alliance is in Harrisburg. Bill Stouffer, they are helping to build new recovery organizations across Pennsylvania. So they would be very helpful in finding recovery organizations that exist, or even people who are starting organizations who would be helpful to you. ProAct, that's us. You're welcome to call anytime. We have an 800 number. If you have any questions and want to call and even get help in other areas, we will help you. As far as recovery residences are concerned, there is in Pennsylvania no central information on recovery houses in PA. They are not regulated. So there are some recovery houses who get funding from the state and from their local SCAs. But the best way I can tell you, and I actually didn't tell Fred I was putting his name on this, but Fred Way has worked for the city and is the executive director of the Philadelphia Association of Recovery Residences, and he is familiar with the recovery residents across the all Pennsylvania as well as other states. So Fred would be a very good place to start. There's a Bethlehem Recovery Center in Lehigh County. There is Easy Does It. It's in Lehigh. In Reading, there is the Lancaster Recovery Alliance that's very active. Guiding Hearts with Hope is in Hanover. I'm not quite as familiar with them, but they are on the ProA website, so I listed them. Message Carriers is in Pittsburgh. TAG is in Katanning. I can say that. That is in the north of Pittsburgh. Sage's Army is in Westmoreland County, and Westmoreland County is very active in the recovery movement. In fact, I'm going to refer to a pilot program that they have done later when we talk about areas of advocacy. So the next exhibit is how does one get covered and what is the process? So, and that is an area that has a lot of people confused, is how do you get treatment, what do you do, where do you go? So Chester County has a roadmap, and this is an ideal roadmap, but at least it shows how the system works on an average county by county basis. So the first line is, okay, are you in a life-threatening situation? Do you need ambulance services? That's a dial 911. You can get detox and go to the hospital. According to this map, the hospital then will provide resources for you. In truth, hospitals do not, and that is an area of advocacy. What we're finding is that there are people who have had multiple overdoses, and they just go to the hospital, and after 4 hours or however long it takes them to recover, they're released, and there's no resource recommendation. So on the far left then, if you do have insurance through Medicaid or through local services, then you need to go to the county outpatient assessment site, and they will give you an assessment and then refer you to treatment. If people have private insurance, which goes farthest down on the left-hand side, people should be looking at the back of their insurance card, call their 800 number, and find out what treatment providers they have access to. I think I will stop it there because there are a couple of things to clarify, but we do that later on in the presentation. The kind of questions that people ask us are really very simple when they call in our 800 lines. Where can I go for detox? Where can I go for treatment? How do I get into treatment? called a treatment provider and they don't take my insurance, what does happen is the treatment providers' databases aren't necessarily, or the insurance companies' databases are not necessarily kept up to date. And so they will just be looking at a list that is not accurate. So they will have to go back to their insurance companies, or for instance, on our 800 line, we will make other recommendations for people to call and see if they can be covered. And the most difficult one is I can't afford my copays. And what is happening now with the Affordable Care Act, although treatment and recovery support, which is not covered by private insurance, by the way, although they are covered for treatment, the copay is $500 a day until you reach your max. So what's happening is that people who have Medicaid or in Medicaid expansion are already originally on Medicaid before the expansion actually have greater access to treatment than the low-income households working for and potentially in what we consider medium income households, depending upon their circumstances. And there's not really much that we can do about that at this point, except in the long run to make it an advocacy issue. What is happening now in Pennsylvania, because some of it has existed before, but with Medicaid expansion, there is a capacity issue. With Medicaid, there is a limited number of providers who will accept Medicaid, so there's a network capacity issue with them. There is a system capacity issue with personnel. Right now, there are long assessment waits to the point in Philadelphia we are actually doing a study there and providing help for people. There are people who have had to wait as long as 5 days to get an assessment to get into treatment. There are shortages for beds. It can take weeks to get beds now. And we're also having difficulty with people when they go into the government system, the community-supported system, that they are offered methadone instead of treatment, that they really do not want medication-assisted recovery. And then the largest issue of all is for both the end user and for families understanding resources and what is available to them. When we look at what has happened with insurance is that the phases of somebody getting into recovery, we call them pre-contemplation. They're thinking about it, what is available to them. Then there's contemplation. Yes, maybe I will do it. The family wants that people wants to do an intervention. They move closer to getting help of some sort. And then they finally go into treatment. And that is the green area that you see on the page. And that really is what insurances have been prepared to cover, which is your office-based, your acute episodes of addiction and treatment. And then maintenance, recovery support is really not covered, at least by private insurance. Medicaid has many, many more options for people in recovery, especially with recovery support services and counseling. So for advocacy issues are the capacity system changes. And what we are trying to do is affect that on local level. There are problems now because of benign neglect. It's just really capacity. Everybody knows that there are problems. It's not by design. So in Philadelphia, what we're doing is the Recovery Access Project, and we've gotten stories from about almost 100 people and getting back to them. Some people have not gotten treatment. Some people did not get treatment but have recovered on their own. And from their stories, what we're trying to figure out is what are some of the simple things that the city can do, Philadelphia County can do to change their system problems. From things as simple as have comfortable chairs in the waiting room, because you're going to have to sit for 4 hours. You want to be comfortable, or have certified peer specialists helping people in the room and getting them ready and sitting with them during the wait period. Parity is definitely an issue. So, the laws have been finalized, and actually parity was passed in 2010. It's existed for a while and refined in, I guess, what, a year and a half ago, maybe 2 years ago now. But insurance companies and even insurance departments don't really understand parity. The length of time that people are given treatment is, in a lot of cases, not enough. We're starting to hear stories of people who have been in treatment for 5 days and are being told their insurance will not cover it, as well as halfway housing. The IMD exclusion, which basically in Medicaid, you cannot, if a facility has more than 16 beds, I think it is, they cannot be considered they're not considered a treatment facility and won't be covered. The different counties work around that in another way, but it should be clarified. As mentioned before multiple times, private insurance does not cover recovery support services. Families need recovery support. For them to get services is absolutely a genuine need. If family, that is one of the biggest parts of someone's successful recovery. And then I have down here in-hospital mobile caseworkers or recovery support services, because people are going in and out of hospitals, especially with the overdose epidemic, and they are not getting help or suggestions on what their next steps are, and families especially are not getting help. In Pennsylvania, we have an Act 106 of 1989, and that actually, if it is, Act 106 is stronger than the Affordable Care Act. State laws trump the Affordable Care Act in insurances. It requires all group health insurance companies drafted in the state of Pennsylvania to include mandated minimum benefits for treatment of alcohol and drug addiction. And that includes group health insurance by HMOs as well. So that's up to 7 days of detoxification for admission for lifetime. It covers a minimum of 30 days for rehabilitation, 90 days per lifetime. It gives you outpatient treatment and family counseling and intervention services, which I have to tell you is really not fully used by people and many times is denied, and people have to go back and get that coverage. There's an additional 30-day outpatient partial hospitalization, and the only requirement for accessing these levels of care is certification and referral from a licensed doctor. And that is, I think, pretty much it in a nutshell. And oh my gosh, I've been going on for a long time.
I'm just going to pause and say thank you. That was really comprehensive and great. And I'm just going to pause if you have any questions. Yes, so we have one suggestion for carriers of Pennsylvania to add them to the list of partners. So we will definitely do that and make sure everyone has the contact information for the groups working in your area. So while folks are thinking of other questions, I want to just launch a poll to see how many folks are currently partnering with recovery organizations locally. So just take a minute and vote in this poll. We just want to get a sense of how many people are partnering or not, and how we can, sort of get a sense of. So we'll hold it open for about a minute so that everyone has a chance to vote. Okay, so right now it seems like a pretty even split between people that do on-site enrollment at recovery organizations, people that are a referral source, and then people that don't have those connections yet but would like to. So we're up to about 58% that have voted, so we'll hold it open for another maybe 30 seconds. Great. Okay. Well, thank you. That was very helpful. Let me ask you if folks don't have a question, if you have a partnership with an organization in your area, if you could just type in the question box and let us know who you're working with and how that partnership formed, I think that would be helpful too for other folks to hear who haven't yet made those connections. Okay, any other questions either for myself or for Noni? Okay, we have a couple questions coming in. We have Pennsylvania Health Law Project works really closely with message carriers in Pittsburgh. Their staff attends the monthly community meetings held by message carriers, so that's a really good idea. Let's see here. We have another question that is, we are in the process of establishing a recovery organization. Who can we contact for support? And that's a great question for you.
So what was this question? Could you repeat that?
Sure. The question is, we are in the process of establishing a recovery organization. Who can we contact for support?
Oh, okay. Pro A, you should definitely contact for support. You can also, I don't have my contact. I don't think I have an email. Here's my phone: 215-345-6644, extension 3100. We have trainings. We're in Southeast Pennsylvania, and a lot of you can come if you want to come and walk through our recovery centers. We are open to that so that you can see things in action. So you can definitely come to ProAct as well. Those are the two resources I would use.
Great. So another question, Noni, you talked about the Recovery Access Project and the stories that you're collecting with some of the barriers and problems that people are experiencing getting treatment. So can you just talk a little bit about what you're planning to do with those stories and some of the next steps for your advocacy?
The next steps that we've done is we've grouped the people into, are there people who, do they need support now because they have either through an excruciating way got treatment or created their own style of recovery, or there are people who are not helped through the system. So in coordination with the DBHIDS and Roland Lamb, we have contacted people who will help us fast track the people who did not get help. So now we are in the process of recontacting people, and in all honesty, it's contacting just about everybody, considering the stories that we got. So our next step is to help them through the system, make sure that people are able to sustain their recovery, and then that will give us more information to take back to the Department of Behavioral Health or Mental Health or some DBHIDS. I forget what the letters stand for right now, and be able to make some recommendations. Did that answer the question?
Yes, definitely. All right, so we'll hold it open just for another minute if anyone has any last-minute questions or any partnerships or new things happening that you want to share with the group that could be helpful for other people who are thinking about forming those partnerships. I will say, too, that Noni and I are definitely available to help. So if you're getting ready to do outreach for the first time to a recovery organization area, it often helps for someone who's trusted within that community to help make that first connection rather than just sort of an outsider coming in. So Noni and I are happy to help establish any of those relationships or just do an e-introduction or anything like that to help get some of these partnerships up in places where they don't exist yet. And I think there's huge potential not only to get people covered and connected with care, but also for the next leg of advocacy to identify some of the problems people are still facing, even with the improvement in access to coverage and care, and how we can continue to fix those problems at the state level most immediately, and then also potentially at the federal level. So,
yeah,
go ahead.
I just echo what Erin has said, the contact information, anything that we can do to help, please contact. That's what we want to do.
Great. Well, then I think, oh, wait, did we get one more final question? Yes. So last question is, is anyone working with the behavioral health plans about access issues? And that's in Medicaid.
Is anyone doing that right now? I don't, yes, they must be. Am I aware of an organized effort? I know that OMSOST is meeting now and looking at 2016, and they are on access is one of the really big issues that they are working on and writing their plan. So I know that much. I am actually part of the working group.
Okay. All right. Well, Noni, thank you so much for all those great information you shared today. I want to thank everyone else, too, for joining. We're going to wrap things up, and we will send everyone a link to view the recording of this. You can share it with your colleagues, and also a copy of the slides and some of the other materials that we've created as we've done more work to promote enrollment with folks that are in recovery. So thank you, everyone, for a great session, and just Godspeed with the rest of open enrollment, and we'll talk again soon. Have a good day.
Yes, good luck, everyone.